This is Nadine reporting for Natural News University, and I would like to address oral care for children. This is a big area, and I get a lot of questions every day about this. So you have a brand new babe and you want to start off right, and they have no teeth, but the teeth have been forming inside your uterus before you give birth. And so during that time, obviously prenatal nutrition is really key. Again, the fat soluble vitamins A, D, and K. And obviously breastfeeding. Breastfeeding is great, and that takes care of the teeth for a long time. You'll see a lot of there's a lot of research you can look up into where our babies are being bottle fed and then they have total rot of their front teeth and those kind of things. So the other thing to avoid with children is any processed food whatsoever, and of course any processed juices. And yes, that does mean apple juice from the health food store. You want to keep it to water and breast milk. So that is key. And then as the child gets older and they start eating some more normal foods, you want to include, again, the fat soluble vitamins and keep things really pure and healthy. And then as they get the teeth in, you do want to take care of them and you do want to start cleaning them. One thing you can do is just take salt water and a cloth and you dip that in the salt water, and then you can wipe each tooth that as they come in, just to make sure that it's clear of the salt, clear of any food and acidic buildup. So that will help your child go to their adult teeth without any cavities. And it's very key for children to not get cavities when they're little. And this is important for when the adult teeth come in. So that's definitely something you have the chance to start them out right in life and to avoid cavities as much as possible. So if something does show up, like a brown lesion on the tooth, keep your eye on the teeth. And that is at a stage where it could still have a chance to reverse. When that brown lesion comes in, the dentin, which is inside the tooth, sends up something called odontoblasts. And that's actually sending new cellular growth to that area. And if you can halt the cavity, that area that was brown is actually got really hard, strong enamel. So don't think if you see a brown lesion on the tooth that like you're on a slope towards a cavity. I mean, you could be, but what you can do is you can reverse that, because that's at a stage where you can get it. If that happens, you want to be looking at the diet and you want to see like how can you improve that. And another thing too, if the child's eating grains, you definitely want to make sure they're all soaked to get rid of any phytic acid buildup. That's very key as well. And so again, if you got the brown lesion, just make sure that you're dealing with it. And if the child's teeth are set close together, you want to begin flossing the teeth as well. And this will bring them through to having really great adult teeth. One thing you do want to avoid if you do go to a dentist is getting the bonding agents put on the molars. As well, that does halt deeper decay. It also traps bacteria in the mouth. And at an age of about 2 or as early as you can, teach your child to swish with salt water and get them to start brushing their teeth. Although you will have to keep an eye on it, because I don't think they're going to get every part, and they're just really learning. And do try to make it really a lot of fun and take your time with the children, and that's going to be a better experience for them to take through for the rest of their life.